Good afternoon and welcome to our webcast, Returning to Work, What Will Business Look Like After COVID-19? For those of you who I've not yet met, I'm Dan Meyer, publisher of BizTimes Media. Today's webcast is presented by BT360, the storytelling arm of BizTimes Media. On behalf of BizTimes and our sponsors, Creative Business Interiors, Davis & Keilthau, and the Horton Group, thank you for attending. In the title of our program, where we reference life after COVID-19, I want to be clear that we recognize that the pandemic is not over and there are still individuals and families affected by the virus. And healthcare workers and others are continuing to help fight this battle. It ultimately won't be over until hopefully there's a vaccine, and hopefully soon. However, from an economic perspective, we all need to get back to business. With the stay-at-home order lifted and most areas in the region now open or opening, businesses are trying to navigate their way to get back on track. Today's program is designed to provide you with some tools and a roadmap to help you make that transition. Many agree that most companies will never get back to where they were earlier this year, but we're confident that the knowledge and information shared today will help you in that journey. Our presenters will address issues related to transition phases, return to work requirements, OSHA compliance, physical space considerations, effective communication and implementation of a return to work strategy, recall and hiring, considerations, and safety and risk. The slide deck will be available for you as an attendee after the program is completed. Before we begin, and on behalf of BizTimes Media, I'd like to thank you for your readership support and for your print and digital advertising support and event sponsorships, and for attending this webcast today. This is our 25th year as an independent, family-owned business, and we're the only locally owned business media company in this region. However, to serve this community for 25 more years, we'll continue to need your marketing and advertising support now more than ever. I guarantee that we'll work hard every day to earn your business and to help you grow your business through our custom and integrated marketing programs. If you're interested, please contact our sales director, Linda Crawford. In addition, our award-winning editorial team is always looking for story ideas, especially forward-looking operational insight stories that can help our readers make more informed decisions in running their company or insights on how to be better leaders themselves. Before I introduce the presenters, I want to mention that today's webcast is being recorded and will be available on demand later today on our website. And please enter your questions in the questions feature below your screen, and we'll get to as many as possible during the Q&A session. And at the conclusion of the program, please fill out the attendee survey, which will allow you to access the slide deck. So now on to the presenters. When I introduce you, please give a quick shout out to everybody. Our presenters are Lori Meyer, Employment and Litigation Attorney with Davis & Keilthau. Hi, Lori, and welcome.
Good afternoon.
And Gary Glader, President of Horton Safety Consultants. Hi, Gary.
Thanks, Dan. Glad to be part of the webinar today.
Yeah, glad to have you. And Verna Shavlik, Director of Interior Design Services with Creative Business Interiors. Hi, Verna.
Good afternoon. Thanks for having me.
Great to have you. So next, we're going to get things going, and Lori Meyer is going to kick things off, where she will cover a lot of issues related to the legal aspects regarding returning to work. So I'll turn it over to you, Lori.
Good afternoon, everybody. I'm really glad to be here today. We're going to be talking today about returning to work. Many of you employers have had to do something in really rapid succession at the beginning of this pandemic issue, and many of you, for example, have had to furlough or lay off employees, have had to institute remote work policies, maybe where you haven't had them before. And today we're going to talk about some of the legal issues. That's going to be my focus on what it means and what considerations you will need when you think about returning those folks to a physical work site, and what kinds of things you should just be cognizant of. First off, I thought it might be important because a lot of the terminology has been bandied about, and make sure that we're talking about some of the same things. Furlough versus layoff. A furlough is not precisely legally defined, but it generally refers to a forced period of time off, whether that be reduced hours or whether it's a chunk of time that, or weeks or something like that, where the person is just generally off duty without pay, intended to be a temporary duration. Obviously, sometimes those furloughs become permanent, but at least at the outset, the idea is that the people will be coming back. Generally speaking, while a layoff, as it says at the bottom there, is a termination of employment, when you're not in a union setting, and a union setting might have certain obligations of an employer in terms of recall back to work that might apply in that scenario. In a non-union setting, layoff is just simply describing the reason for the termination, but the person is in fact separated from employment. In contrast, a furlough, a person, while they might not be paid, they are generally speaking eligible for benefits. Their benefits continue. That is, of course, contingent upon the terms of the plan documents for whatever benefit plan we're talking about. But that's the case. But it makes sense, just before we get started in returning to work, to do a little housekeeping to make sure that if you furloughed employees and those benefits have continued, that you've accurately and consistently communicated what that means for employees about benefit continuation, and make sure that that is accurate. Because you don't want to get into a situation where you've assured people that their benefits have been intact and they have not. Can you advance the slide? So when you're thinking about returning people to work, the first thing that you have to determine, I know we did a survey, or BizTimes did a survey to figure out what phase you are in, and it seems from the attendees on this webinar that people are really all over the place. Some people have not started a plan, some people are in how they define phase 1 or phase 2. Maybe people are thinking about very long-term solutions to changes in the workplace, things like that. But if you are, in fact, returning employees to a physical workspace in phases, or even returning people to work even in a telework situation, and some people are coming back maybe because production is down, or you find you don't need as many people. One of the first liability concerns that we want to talk about is avoiding discrimination and retaliation. If some people are going to be brought back to work and some people aren't, how and why are you going to make those decisions without running afoul of some of the discrimination and retaliation claims or laws? For example, you should absolutely be able to articulate a legitimate, non-discriminatory reason for the decision. It's a job function and a particular that we need, and a particular employee versus another employee has the adequate skill set to make that happen. There is a business need, other people aren't. Can you articulate it? Maybe it's something like first in, first out, and therefore, maybe the most recently hired or the person with the longest tenure with your company may be favored, but it has to be something non-discriminatory. What you can't do is you can't make assumptions about an employee's vulnerabilities without more information about that. You can't assume, for example, because of age or something else, that a person will not be able to telework or be able to deal with the technology, or that they won't want to come back. You can't make those assumptions right off the bat, because you might run into a situation, even if your concern is really benevolent. You care about your employees, of course you do, and you are concerned about maybe some of your older workers and things like that. What you don't want to run into is implementing kind of a plan that really has a disparate impact on older workers or disabled workers or things like that. So be careful, make sure that when you determine who you're going to bring back and when, that you're doing that for non-discriminatory reasons that you can articulate pretty clearly. You also don't want to get into a retaliation situation where there can be a suggestion that there's payback. You didn't really appreciate that person taking family's first leave, emergency sick leave, or taking care of their children as an expanded family medical leave, and that there's some kind of, I'm going to remember this kind of thing. Make sure, again, you can articulate those non-discriminatory reasons for different treatment of folks. Okay. One of the most common questions I get as an employment lawyer is when can I make people come back, especially if they don't want to? And that was a repeated question from you all when you registered here. Many variations of that same question. You know, oftentimes you have folks you might suspect thinking, well, I'm collecting more on unemployment. I don't want to come back. Maybe it's a generalized fear of coming back. Maybe it's because they have family members. Maybe it's because they have health conditions themselves or age issues. What you don't want to do is establish a blanket rule. Everybody comes back on June 15th, no matter what, and that's it. And if you're not coming back, you don't have a job here anymore. What and I'll explain why that can get you into a lot of trouble as we go down this. But what you should first do, if you have an employee who says, I'm really not comfortable coming back, you need to drill down and you need to ask why. You need to find out why the employee is refusing or is uncomfortable coming back to work. We're going to think about some of the reasons as we go through this, why a person would not want to come back to work. Let's say the person has a medical condition or even medical, and that includes both physical or mental disability, that is the reason that they are providing for why they want to come back, don't want to come back. Maybe they have diabetes, maybe they have a heart condition, maybe it's a mental issue like they have panic anxiety disorder or depression, something that would be triggered that, that would make them feel like they don't want to come back. If that is supported by medical documentation, and you can certainly ask for more information from a medical professional, you may legally have to accommodate with a temporary leave or telework if that is possible, both possible and reasonable. Of course, there are jobs that people cannot do remotely. But if it is a temporary leave, not an indefinite one, maybe somebody has to get medication in order or something like that, a leave of absence may in fact be legally required as a reasonable accommodation. Of course, we're distinguishing between legal accommodations required, again, under the ADA or the state equivalent, and then there are discretionary ones that you as an employer might decide to do for morale reasons, or for, simply you have a long-term employee, you want to bring them back, but you want to tread lightly there. Another issue that might require a certain amount of leave would be if somebody has symptoms of COVID-19 or a doctor directive that they stay home. That might be enough to trigger the emergency paid sick leave provisions of the Families First Act, and so you should be cognizant of that. If they say they need to care for a family member, well, which family member and why? Is that a child that is out of school? That may in fact trigger out of school, and maybe childcare is not available as we're walking into summer. That may be enough to trigger expanded FMLA under the Families First Act. If they are, and just before I go on to FMLA, I want to just make a point here that I've seen some employers who are under 50 employees make the assumption and make a blanket decision that the FFCRA and the expanded FMLA do not apply to me because I have fewer than 50 employees. Be very, very cautious, and I would suggest that if you're going to claim an exemption as a small employer for that you consult with legal counsel before you do that. The general consensus is that is not a blanket exemption, that in fact you have to make that analysis of whether or not an individual employee's request triggers one of the criteria for the exemption on a case-by-case basis, not we don't give expanded FMLA here because we're under 50. That is a very dangerous place to be, and I would suggest that if you're doing that as a blanket rule, that can get you into trouble. So I would suggest that anybody who's going to do that, consult with counsel if they do that. Then lastly, if the family member is that the person is caring for is enough to trigger what I'm going to call regular FMLA. That might be unpaid leave, but still leave, job protected leave that you might need to provide. Again, the ADA, which is the disability discrimination law, does not require you to accommodate somebody else's other than your own employee's disability. You might be triggering a need for unpaid leave under the, quote, regular FMLA, and I just want everybody to be aware of that. Next slide. So then the next question you should ask yourself is there a county or municipal safer at home? I know there's been a lot of them are dwindling down and expiring here, but just first ask that question, because a lot of those safer at home orders encourage telework where possible. That might need not be a legal mandate depending on where you are, but you should at least ask that question. If you have determined that a person is refusing to come back to work, they don't have a disability or a suspected disability, they don't have a family member who's disabled that they might be taking care of under regular FMLA, or Families First leave is triggered or something like that, and you have determined that telework or remote work is not possible, you should still ask the question, why are you refusing? Make sure that that's true. And then dialogue, see if you can give them assurances about what PPE and other safety measures you have invoked. I know Gary and Verna are both going to talk about some of the things that employers can do to make their physical spaces much safer, and you can talk to your employees about those. And then you should document their refusal and their reasons. That certainly comes up in the PPP context. You know, the Department of the Treasury issued some guidance several weeks ago that said, that issued the, you know, is this going to impact my loan forgiveness if people come back? You know, their directive, of course, is that the Treasury is like, no, it's not going to affect your loan forgiveness as long as you document an offer of a job and document the person's refusal to come back. So that is why that is very important there. Carefully document a discipline and discharge. Unfortunately, sometimes it comes to be that a person does not want to come back to work, and you simply can't hold the job open, and you're going to have to replace that person. That requires careful documentation of the reasons, and careful documentation of the reasons the person is giving for not coming back to work, and of the discharge. Just really quickly, I want to go through this. I know a lot of you have seen this before, and I know Gary's going to talk about taking temperatures and screening and things like that in a little bit, but just from a legal perspective, while generally speaking, taking temperatures and someday maybe, you know, testing, you know, employer testing for COVID and things like that, those would have in another age have been considered medical tests, which would have been forbidden by the ADA according to the EEOC. However, since the COVID-19 pandemic, they have changed their stance on that and said that given the seriousness of the COVID-19 pandemic, taking temperatures, employees taking temperatures and doing screening questionnaires is acceptable in certain circumstances. When you're talking about taking temperatures, that's, you know, the results of that should be kept confidential. Same thing if you're keeping a daily log of those kinds of things. If you are taking tests, I can envision many months from now, if that ever becomes possible, that you can take a test. If you are literally swabbing someone, you know, taking a oral swab or something like that, or a nasal swab, you are by definition collecting genetic information, which might have implications with regard to GINA. GINA, you might not be familiar with, is the Genetic Information Non-Discrimination Act. There's also privacy protections for all medical information, you know, for the same reason that you should always have a different personnel, you know, you should not keep medical information in a personnel file. Same thing here. You should be keeping all medical information confidential and outside of personnel files. What you should, if you're going to use a screening questionnaire, lots of employers are going this route rather than temperature taking. They're asking employees, whether on a daily basis or one time with some sort of continuing obligation, that they, you know, report any changes that happen over your original questionnaire. In that case, you know, lots of employers are doing that. What you should be sure about when you look at your questionnaire, make sure it's only asking about COVID-19 symptoms, those symptoms that are defined by the CDC. Those who talk about fever and loss of sense of smell or taste, things like that. All those things that most people are familiar with regard to the CDC. What you should not be asking is, do you have diabetes? Do you have a heart condition? Do you have all those things that are not COVID-19 symptoms? Now, if you want that information, what I would do and what my recommendation to you is that you simply invite employees, just in a statement, if you have concerns about vulnerabilities, and don't mention whether it's age or disability or medical in any way, but if you have vulnerabilities that you would like to discuss, to come to you privately. You don't want to require they fill out essentially a medical questionnaire, a medical inquiry that says, you know, these are all of my health conditions. That's not a place you want to go. The other thing is, if any of you as employers have attendance bonuses or things like that, that would theoretically incentivize a dishonest answer on that questionnaire, be careful. You might want to reevaluate that attendance bonus during this kind of time. You can require employees, even exempt ones who aren't punching in, punching out, to log in and log out of a building and facility, so you know who was where and when. I know Gary might be talking about contact tracing and things like that. It's a whole lot easier to do that if you know who was around and when, at what time of day, things like that. That is something that you can require if you choose. There might be accommodations during your reopening. Accommodations, what I mean by accommodations is, of course, disability-related accommodations. A person is allergic to latex. They need a modified face mask because they have some kind of breathing condition. Another one I don't have here, but you know, is something that's been coming up, is employees saying they have claustrophobia, and they, you know, that may or may not be a disability, you know, if it's documented, and it might be something that you need to accommodate on a case-by-case situation. You need to discuss alternatives. The interactive process, just like in any other situation, is you just have to talk to your employees and find out what's what and what other things you can do. If the person can't, for example, wear a mask for whatever reason, is there something else that you can do? Is telework possible for that person? Is it not? If it's not, because that's not what their job is there something else you can do? And I'm sure lots of things that Gary and Verna are going to talk about today might be something that you'd consider. I have seen a lot of employers ask the question, and I am talking not of waivers and releases in the public, you know, public customers, things like that, coming into your place of business, but I'm talking in the employment context specifically. They've suggested, can I get a waiver or a release document that where employees are releasing liability, you know, if they come back to work? The answer to that is no. One, because it's not going to do you any good and it'll probably do you harm. Waivers and releases, if you think about what is the employer liability for an employee getting sick from COVID on the job, that is work comp world. Generally speaking, work comp is the exclusive remedy for injuries on the job, and you cannot, as an employer, ask an employee to release, even prospectively, work comp liability. OSHA, which I know Gary's going to talk about in a bit, there is a general duty clause. There is a general duty to of every employer to provide a safe space, a safe place for a safe workplace, and suggesting that you know, that, hey, employee of mine, please sign this waiver or release, might actually hurt you in an OSHA investigation, because you're kind of implying that you might not be providing that. So don't go there. Rather, my recommendation is that you get employee acknowledgement. And an acknowledgement is not a release of liability at all. What it is just the employee is acknowledging that you've taken certain steps. For example, you've provided them with a mask. You've provided them with gloves if gloves make sense under whatever the scenario is. Maybe you've given them a flexible work schedule. Maybe you're alternating employees in the office and out of the office, or in the workplace and out of the workplace. Maybe you're, staggering work times. What are the steps you're taking when you put together your return to work plan? If there has been an opportunity to telework that maybe they don't want to do or something like that, maybe just you document the fact that at least it was offered. Document what that you've at least advised them that what sanitizing and cleaning steps that you're taking. And if there's been workspace alterations, you're moving people apart, things like that, document that and have them acknowledge it. That is, again, just want to make clear, that is not a release of liability, but it may help you guard against someone saying that you didn't take certain steps when you did. Okay, so one of the other issues that I'm seeing quite a bit is you're implementing all these different rules in terms of a return to work plan, PPE, coworker complaints. So and so is not wearing a mask. The person is refusing to do that. Differentiating, of course, between in and out of workplace. You're getting into a difficult area when you're getting a complaint from an employee. I saw, so-and-so, Joe down the hall, he was at a bar last night and he was on the news talking about it. That's actually been a thing. Right now, in most places, in our safer at home rules are being either rescinded or they're expiring. So you get into a situation where if you are coming down on someone for out of work lawful conduct, you might have a problem because there is, at least in Wisconsin, there is a law that says that you can't discriminate on the basis of lawful conduct out of work. Be careful there. But if you're talking about mask wearing or other PPE, and a person isn't, respecting social distancing, those kinds of things, you can insist on it. In a private sector situation, an employee does not have a constitutional right or anything like that not to wear a mask. You can, as an employer, require it. You can require other PPE, you can require social distancing, you can require all of the rules be respected. Now, you should also understand OSHA evolving protections. You should keep it, we're going to talk about that in a little bit. You should make sure those rules are changing all the time. You should keep up to date. When I say NLRB, most employers, many employers realize this, but not all. And so I think it bears mention that the NLRB, which is the National Labor Relations Act, which a lot of folks think of in union world, they think, well, I'm not a unionized workplace, therefore I don't have to worry about the NLRA. But the NLRA applies even in non-unionized workforces, and it provides protection to employees for what is termed in the law as protected concerted activity. So make sure protected concerted activity it's protected in the sense that it's complaints and things like that about terms and conditions in the workplace, and it's concerted in the sense that it isn't what we call an individual gripe, but it is a concerted in the sense that it is a term or condition that is experienced by more than just the individual employee, but by all of the employees or a group of them, and that the person is either joined in their complaint by other coworkers or they are expressing a complaint on behalf of them. So if you have an employee who is complaining about what you are doing as an employer to protect them, and they are making complaints, be very, very cautious before you take any adverse action against that employee, because they may in fact have a claim for a violation of their rights to engage in protected concerted activity. Same thing with what we call public policy or whistleblower complaints. Those are complaints, whether it be a person has made an OSHA complaint or a person has made a complaint, generally speaking, that what you are doing or are not doing violates a well-articulated public policy, whether it be in a statute or regulation, that protects them from any kind of adverse action coming out of that complaint. So just be cognizant of that.
Lori, maybe one more minute.
Oh, sure. Okay. So my advice is to have a clear return to work plan. Don't have an ad hoc response, and moreover, do not set it and forget it. There is a great deal of guidance out there. We'll talk about in my very last slide, which provides the all of the different links to the different guidance, but there is not going to be heard an argument ever that you don't know what you need to do. There's guidance all over the place, and you should keep on it. There may, in fact, be a surge of OSHA claims, and OSHA investigators are going to have a hard time. It's going to be a very difficult conversation for you. If you are in, people are thinking, well, the OSHA and the CDC guidance isn't mandated. It's not legally mandated. I don't have to do it, or I only have to take it as a suggestion. But it's going to be a difficult conversation for you with an OSHA investigator if your attitude is, I didn't do anything. So, make sure that you have a plan, have it be written. Talk about, what are you going to do if there's an affected employee? What kind of testing, screening, PPE are you going to do? Review your employee handbook policies. Wage and hour and telework. Be cognizant of the fact that, especially for non-exempt people who have been teleworking, they might not be reporting overtime. And why? Well, they might be very, very concerned about job security. Maybe they don't want to talk about that. So you have to make sure that you have a very clear telework policy as to non-exempt employees who might not have ever had that ability before to capture all the time. Make sure that you have a clear Families First policy. Make sure that all the posters are up. Make sure that you have procedures for leave request documentations. And the like. Can you go to the last slide there? I want to apologize. I inadvertently left off the OSHA site link. It's very easily found at OSHA.gov. But these are a few of the federal, OSHA and CDC are federal agencies, a number of the Wisconsin ones, because I'm in Wisconsin, I placed here. These are things you should be bookmarking and keeping up to date with. For example, OSHA is very industry specific. You can go in there, and if you're a manufacturer, go to the manufacturing section. If you're a restaurant, go to the restaurant section. But make sure that you are up to date. Those things change all the time. I know Gary, I know we're going to hand it over to Gary in a second, and he is going to talk about a lot of the OSHA and CDC guidance, but thank you for listening.
Right. Thank you very much, Lori. Great information. As a reminder, this webinar, webcast, is being recorded and will be available afterward. So next is Gary Glader with the Horton Group. Gary is going to talk about all those things that Lori just mentioned. I'm sure there's a few safety and risk concerns as businesses are getting back to business, Gary, so take it from here.
Thanks, Dan. So what I'd like to talk about is COVID-19 in the workplace and what employers can do to protect employees first and protect the companies at the same time. So when the COVID virus first hit, it grounded all of us. We have a dozen full-time safety consultants that were servicing clients in the field, and when it hit, we were grounded like everybody else was until we could figure out what to do. But at the same time, we found that we had a number of clients that are essential business operations that were struggling to know how to protect their people in the workplace. And this was when things were relatively new. So we kind of changed direction, and we started developing what I call exposure control plans to help our businesses that were essential business operations be able to make it through these times without infecting employees and having the whole thing fall apart. So those of you who are looking to return to the workplace, you're looking at going back to work very soon. Fortunately, knock on wood, the news seems to be good so far in that the infections are on the decline. There are a few hot spots in the country, but I think generally overall, I'd like to believe that things are getting better. And no doubt, if you're not in the workplace yet, you're kind of freaked out about what to expect. Well, fortunately, we have the experience of the essential employers who never left the workplace, who remained in the workplace, and through their experiences, good and bad, we've learned from that, and hopefully we can bring some of those things to your attention. Just to list some of the things that did happen with essential employers is that they experienced the spread of the virus at work. There was no doubt. It's not as though when you went to work you were exempt. We had a client who ended up with about 30 positive COVID cases at work. They called us, retained our services, and we helped develop and implement an exposure control plan. High absenteeism. Clearly, you have people that may be at high risk groups or even people that aren't, that are afraid to go to work. And that was a big issue. Not having enough employees to actually do the work that was required. People come to work, they're freaked out. Lori mentioned this a little bit earlier. The OSHA complaints are at a record level, and they are really pretty much limited to COVID-19 concerns. Personal protective equipment, which can and should be a part of many of your programs, is still in many cases difficult to source because of the strong demand. And employers simply just didn't know what to do. This is a novel virus, novel meaning new. People didn't know what to do, including the government. So what I'd like to do is talk a little bit about the workplace program. And there are really two elements of an effective COVID-19 workplace program. The first thing is to do a thorough assessment of the workplace. Identify where people may be working in close proximity. Identify tools and equipment that employees could use on a shared basis. So those are the things that could result in a transmission of the virus from the workplace to an individual. So we need to complete that assessment. Once the assessment is complete, then it's necessary to develop a comprehensive and site-specific exposure control plan. I would like to say, though, that there's so much information on this subject that it's overwhelming. It's overwhelming for me. I try to keep on top of the stuff, and there's stuff just coming in at a pace that's too fast. Most of the COVID-19 precautions that you see being communicated are advisory in nature. So I guess one good example would be temperature taking. If you want to take an extremely risk-adverse position, then you would implement temperature screening, but it's not a requirement. Just because people are doesn't mean that you have to too. I think you have to take a look at changing circumstances. That would be paying attention to the number of cases that are occurring in your particular area or where you may be sending people, and then develop and implement practical approaches that consider the circumstances. So I don't have an example for everything, but a good example for temperature taking. If you had thousands of employees working inside of a building in close proximity, such as a meat processing operation, then it might be prudent to have temperatures taken before people report to work. On the other hand, if you're populating an office building where there's very low density of people working in that office building, and there haven't been an outbreak of cases in your particular area, temperature taking isn't necessarily something that's going to be that great of a benefit to you. So I would urge all of you to take a practical approach to COVID. We're involved in risk management. Risk management doesn't mean eliminating risk, because in many cases, if you eliminate risk, you eliminate the business operation. So we have to come up with some healthy midpoint at which we can keep people safe and still operate our businesses. So I'm going to look at the different elements of an exposure control plan. I'm going to blow through the material fairly quickly. The first element is infection prevention. And infection prevention includes the questionnaires. Lori talked a little bit about questionnaires as well as temperature monitoring. It includes testing. There may be components of testing that may be of benefit to you. It includes work at home policies. One way of preventing infection in the workplace is to allow people to work out of their homes to the extent that that's possible to avoid the spread in the workplace. Handling visitors and deliveries. We had a couple of questions from participants about how do you handle visitors? Same thing when it comes to travel policies. We have people that travel on business. Are we going to shut down business travel? Are we going to handle it in a practical way that helps minimize the exposure to your employee or to the public? Little bit on testing. At first, when the virus hit, there was very little testing capability available for obvious reasons. The virus was only just at that time being studied, and tests hadn't yet been developed for this virus that didn't exist until we found out about it. But now we're getting to the point where testing capability is expanding. And we're talking about viral testing here because there's two types of testing. One is viral testing, and that is to determine if you are infected, currently infected with the virus. You could be asymptomatic, or you could have symptoms, but viral testing determines if the virus is present in your body now. The one drawback with viral testing is it only identifies persons who have the virus at the time of the test. So if you intended to populate the workplace and tested 200 employees, that's great, and that test was good at the time it was given, but 1 day, 2 days, a week later, we don't know if your people are going to be coming to work infected by the virus. I do believe, though, that additional and faster virus testing will help prevent the spread. And that is by giving the test to people who work in essential businesses or people who think they may have been exposed. They should be able to easily go find a test and determine that they're negative or possibly positive. The other type of test is antibody testing. This is something that is a very hopeful technology that will help us understand if a person has been infected with COVID-19, and if it proves that COVID-19 does develop immunity in individuals that were exposed, that means that individual may be protected from being reinfected again. And it also means that that person will not be a carrier of the virus once they've gotten over their initial infection. The problem is that we don't know that exposure to COVID-19 does result in strong and lasting immunity. It's a coronavirus along with MERS and SARS, and the good news is that those coronaviruses did actually result in people developing strong and lasting immunity. Some of you may have heard this story, but they have done some preliminary antibody testing, and we know the number of positive cases diagnosed in the country. It's estimated that the number of people who were actually infected with the virus could be, in some cases, as much as 50 to 80 times greater. We just don't know because they never got the viral test to determine that they were in fact infected with coronavirus at the time the test was given. So this is promising information. We can't hang our hat on it yet, and it could be a strategy, if nothing else, to give people comfort when they go back to work that there's a strong likelihood that they won't be reinfected again. I would have to defer to Lori. Some people think that they may be able to use antibody testing solely to repopulate the workplace. That could be problematic from a legal standpoint. Another aspect of the COVID-19 virus is to the exposure control plan is to develop and implement engineering and administrative controls. And these include things like social distancing, density reduction in the workplace. Verna is going to talk about specifically how to accomplish some of the distancing and density reduction in the workplace. As a rule of thumb, if you assume that we want to keep 6-foot social distancing between people at work, if you take the square foot of an area, let's say we have a 10,000 square foot office space, you take 10,000 square feet divided by 36, and that will give you the number of people that should safely be in that space with 6-foot social distancing. 36 represents 6 foot by 6 foot, the square of 6 is 36 square feet. Some other things that can be done are adding shifts. So we have too many people in that one place. Let's split it in half. Let's split it in thirds and add shifts to reduce the density and increase the social distancing. It includes physical barriers. Anybody who's been to a grocery store or any type of store that's open right now knows that the plastic barriers are up, and that is to prevent the spread of the virus either by contact or by breathing, sneezing, coughing, etc. It does get complicated, and when we've worked with clients to do the exposure control plan, during the assessment, clients had done a fairly good job, but we looked at a forklift and we said, have you assigned the forklift individually to people to operate during the shift? And they kind of looked at us with a puzzled look, and we pointed out the fact that if you don't dedicate equipment to an individual, you're going to have to make an effort to clean and disinfect that equipment after each use. So in some cases, it's actually easier to assign the equipment to an individual for the shift. The last thing I would say as far as administrative controls, and this is counterintuitive, for many manufacturers who are in the audience, it's a wise thing to rotate people through jobs to eliminate the risk of ergonomic type injuries, carpal tunnel syndrome, repetitive strain disorders. But rotating people can cause people to be exposed to the same workstation being used by another individual. And again, unless you're prepared to actually clean and disinfect that workstation, it's probably not a bad idea in the short term to eliminate job rotation so that you eliminate that exposure. Spend a few minutes talking about personal protective equipment. A lot of confusion here. First, let's talk about masks. And I'm talking about the surgical masks such as what you see depicted on the slide here. I need to make it perfectly clear that masks only protect those who are near the wearer. The mask doesn't necessarily protect the person wearing it. It may protect in a case where somebody coughs or accidentally spits from getting those large droplets on your face or in your mouth, but the very fine aerosolized droplets that are in the air when people cough and sneeze and actually even breathe, it will not prevent those aerosolized droplets from being inhaled. So I think it's really important during communication and training of people that it's made very clear, masks do not protect the wearer. They protect everyone because it prevents everyone who's wearing them from expelling a large volume of droplets into the air. There is respiratory protection that can protect the user. And probably everybody in the audience now knows exactly what an N95 respirator is. So an N95 respirator will protect the user from those aerosolized droplets. It's a much more effective method of protecting the person wearing it than an ordinary cloth face mask. However, if you intend to issue N95 respirators to your workforce, and I would encourage you to consider a move like that, especially for higher risk individuals, I would suggest that you offer those on a voluntary use basis. It gets very complicated with OSHA compliance. If you require people to wear an N95 respirator, it kicks it into an entirely different level of compliance. You have to send the individual for medical testing. You have to fit test the person in the respirator, and the amount of training that you have to do is much more extensive compared to what must be done on a voluntary use basis. Little bit of time about cleaning and disinfecting. This is actually spelled out by the CDC. I would encourage you to visit the website and identify the frequency of cleaning that they recommend. There's also a deeper cleaning that is recommended if a positive case is found in your workplace. So if you have a rash of positive cases, it might be time to bring a professional organization in to actually do a thorough disinfection. Communication and training is always important in a health and safety program, but honestly, I believe it's extremely important when we're talking about the virus. The biggest cause of fear is not understanding, a lack of information. The more you communicate the existence of what you're doing to keep people safe, the less frightened individuals will be. They may be inclined to come with you with questions. But if you're doing things and you're not communicating that to people, they don't know any better. I think it's really important that you intentionally make an effort to almost even over-communicate with your employees about what you're doing to help keep them safe. I also think it's important that you have supervision and management trained in actually enforcing your COVID-19 program, your exposure control plan. You can have a program in writing, but if OSHA goes out onto the factory floor and sees people that are not following what's identified in that program, you're setting yourself up for a citation. And that brings me back to a point that's somewhat related to getting your supervisors and management involved, which is it's important to conduct periodic audits. We've had a number of clients who actually developed their own formal written exposure control plans, but they weren't sure if they had done it the right way. So they called us in. One of our consultants went through and conducted an audit of two of their large manufacturing facilities. And what we found was kind of frightening. What we found was that the plan that they had developed was not being enforced in the workplace. So this is an important feature of any program, which is to periodically audit your program to make sure that the elements within the program are actually being followed. Documenting things, and Lori talked about the importance of documentation. Documenting these things can help you establish the good faith that may help you during an OSHA inspection. OSHA doesn't have a standard for COVID-19. Actually, I saw an editorial that criticized the agency for not writing a standard, but that's ridiculous. It takes the agency sometimes decades to publish a new standard for health and safety, so it's absurd to think that they could do this in this short of a time. However, Lori mentioned the general duty clause, and what OSHA will do is say, you should have availed yourself of the information available on the OSHA website, the CDC website, and you should have put something in place. The only way you can demonstrate that you have a program is to be able to produce that program in writing. And the same thing applies to periodic audits. A few notes about OSHA compliance is that OSHA changed its position 3 times in the span of about 3 weeks maybe on record keeping and COVID-19 cases. Originally, OSHA's position with communicable diseases, for the most part, except perhaps those in some healthcare situations, has been that contracting the cold or the common cold or the flu at work is not an OSHA recordable case. Well, I can't remember if it was, I believe it may have been in early March, the agency changed its position and said that employers should record COVID-19 cases, but they got a lot of blowback for that because you can get the virus away from work. So OSHA moderated its position and said that a case is not recordable unless the employee works in healthcare, is a first responder, or works in corrections. They're also careful to note that you have to record a case that may be work-related, but it's going to take a lot to prove that. There was recently something from OSHA that came out that said that they expect employers will investigate positive COVID-19 cases. And this needs to be part of your program. We're not talking about something as complex as contact tracing, but you would need to sit down with the employee who has a positive case and ask them who they came into contact with. If you have surveillance video, try to identify who they may have worked with. The whole point is, let's find out who else may have been exposed. Perhaps your workplace had half a dozen positive cases, and the person who has just now tested positive was working in close proximity to them. I can't give you a concrete answer, but I can tell you that OSHA does expect that you're going to conduct some type of investigation to try to determine where that case may have come from, even albeit as imperfect as that situation is. The agency is inspecting workplaces currently for COVID-19. Initially, they may handle the inspection by phone, but they are showing up in person as well, and they are issuing violations under the general duty clause for noncompliance. The agency made a point in April of announcing that it would recognize good faith efforts, but you're going to have to document those good faith efforts. This is new territory for everybody. If you're doing something good, take credit for it by putting it into writing. I did mention that the agency has been extremely active. They issued a memo on May 19th and announced the creation of an updated interim enforcement response plan. It's many pages in length. It's in a great deal of detail. It's actually a memo that was issued to compliance offices explaining how they should enforce COVID-19 in the workplace. If you're concerned about the details of what they're looking for, which kind of informs you on what you should be doing, I would encourage you to take a look at that memo. And they will be looking at OSHA record keeping, particularly in those industries that are known or suspected of having COVID-19 exposures. In summary, in wrapping up what I have for the day, I would have to urge the listeners that to develop a program is going to be key for your businesses. Either if you're in business already, I encourage you to do it immediately. If you're looking to get back to the workplace soon, I would encourage you to take a look at it. We, as a consulting firm, we have developed expertise in helping employers to complete the exposure assessment and to complete the exposure control plan. So if you're looking for help, help is available. If you want to do it on your own, I would use the resources in some of the material that Lori presented. And that's all I have for right now.
All right, Gary, thank you so much. Let's turn it over to Verna Shavlik with Creative Business Interiors. Verna, what do we need to know about physical space considerations as people are continuing to get back to work?
Well, I don't think my portion is as complicated as the legal or insurance portions of this, but I will share with you a lot of the information that we have gleaned from a variety of sources. And the first thing I would say is the workplace truly matters. It is important to all of us. It provides a sense of community, it supports human interaction, and it connects individuals with the organization as a whole. We absolutely can create environments that support the health and wellness of your workforce, as well as offering separation. And truthfully, design professionals are design thinkers. Design thinkers, we solve problems. COVID-19 is another problem that's impacting the workforce. The workforce, the workplace is always changing. It's constantly evolving. So we need to be flexible and we need to think through how to approach this. From our perspective, I'm going to break it into 3 phases. I'm going to talk about short-term, mid-term, and long-term phases, or things that you can do to start implementing your workforce back into the office. Whatever that means and whatever phase you are currently operating in, you can glean something from each phase that we're going to go through. So for the short term, everyone has a different need. Everyone is coming at this from a different perspective. I actually think Gary mentioned yesterday the 3 different types of people, or 3 different comfort levels with how people are approaching things. And I think that's extremely accurate. So in creating a solution within the environment, you have to consider that everyone is different and you are different. Your organization is different. Your culture is different. So taking this information and applying it to your organization is probably the best solution. Transitioning from the home to the office is also kind of an interesting topic, because there's a lot of people that we've worked at home periodically previously. Maybe our home office was our previous office. Maybe our home office is going to continue to be an important element of working in the future. As this pandemic and COVID-19 is continuing to evolve, we don't really necessarily know 100% what's going to happen. If an outbreak occurs, you need to be prepared to send your workforce potentially back home. So taking a look at that home office now as people are coming back to the office and understanding, do people have a healthy work situation? Are we providing, as an employer or an organization, healthy ergonomic tools, just like we do in the office setting or in the office work setting versus the home work setting? So where do we want to look at improving that home office setting? Height adjustable surfaces, ergonomic accessories such as monitor arms or height adjustable chairs, task chairs. We really want to take an opportunity now to revisit the home setting, because again, we don't know if that's going to go away or it's going to come back, and we want to be prepared. Next slide, please. In addition to that, now we want to take a look at bringing people back into the office setting. We're all getting used to looking at visual cues, right? We go to the grocery store, we go to Target, there's an X on the floor and it says, stand here. Well, now we need to think about implementing some of those visual or visual cues into the office. Graphics, decals. Again, this is a short-term solution. This is the psychology of continuing to develop behaviors, reinforce behaviors that people are getting comfortable with at home. Now we need to bring it into the office. Some people are going to come back and think, oh, it's comfortable here, I'm back where I need to be, I don't need to do these things. So visual cues are going to be important. This can be everything from lines on the floor, this could be signs, wash your hands, this could be sanitation signs at conference rooms that say, don't forget, you need to sanitize this surface, you need to sanitize the chair and any tool that you've used in those conference spaces. Next slide, please. Separation. This is a topic that comes up quite frequently. Do I need to put up barriers, visual barriers, separation barriers, plexiglass barriers? And we're starting to see them in more and more organizations and places. These are easy, short-term solutions. There are universal tools that can go to any product or any solution. You might want to consider it for greeter areas, reception areas, or concierge type surfaces or stations. This could also be implemented into conference rooms. If you have tables that are not quite the right width, you can put a plexiglass separator down the center of that table in the short term to help create some barriers. This is the psychology of creating protection. Next slide, please. Sanitation protocols. We've talked a lot. You've heard Gary and Laurie talk about this, and this is important. You need to develop your protocols. You need to understand what you want to do, but now we need to post that. Post that with a visual cue to reinforce that psychology that people need to maintain this. You also can post the wipes or the sanitizer. All of those things can be located in key places, or they can be located everywhere. Depends on your comfort level with sanitation. But we definitely need to create cues to help people remember to do these types of things. Next slide, please. We have heard over and over again, washing your hands with soap and water for 20 seconds is the best way to kill the virus. Well, thinking about your own environment in the office, you might have areas that have a sink but weren't historically hand washing stations. Things like hospitality areas or beverage stations. Simply by putting soap, signage, and paper towel dispensers, you've now created a sanitation station that was previously something else. If you don't have other areas within your facility and you want to promote washing your hands with soap and water, there are devices like portable sinks, portable sanitation that you can explore and add throughout your space. Next slide, please. We're back to those visual cues. Understanding, and Gary, you did a great job of understanding and explaining square footage. Taking a conference room and saying it currently or historically was a 14-person conference room. Well, now I can only accommodate 7 people. This is posting a sign on the door. This is creating maps, visual cues of that room, and highlighting where people can sit. Also, how they need to move throughout the space to limit circulation and exposure. In addition to that, another layer of this would be to eliminate the chairs or to put stickers on the chairs that say, don't sit here, but sit here. Probably the best thing to do here would be to eliminate seating and take that choice away. That visual cue is now gone. Now you walk into this large conference room and there's 7 chairs. You know where you need to sit. Next slide, please. Those same visual cues, maps posted on doors or in areas, as well as removing furniture, also apply not just to enclosed spaces, but to shared enclosed spaces like break rooms or fitness rooms. Think about shared spaces that everyone uses that potentially has a higher density, but now it can't have that anymore to maintain social distancing. Next slide, please. Now we get into the work areas. This is challenging because a lot of us have very dense floor plans. We need to get as many workers or as many workstations, workplaces within an environment for your workflow processes. But what we found is now everybody's gone home and working. How do you bring them back and have people feel safe that they can go back to a desk, maybe not their same desk, but go back to a workplace? Bringing people back in shifts, group A, group B, that can help with social distancing in dense floor plan areas, or also creating rotations, as Gary mentioned, but having a very defined sanitation protocol in these shared workspaces. So when I'm done working today, maybe tomorrow I'm going to come back to the office, but I'm going to sit somewhere else. So before I leave, I sanitize the place I was working in, and then in the morning when I come back, I sanitize the new place I'm going to be working in. So I'm maintaining my own sanitation to the place I'm working. People are comfortable in their own dedicated workspace. They think no one else will be there. And that's not necessarily the case. After you've left at the end of the day, the cleaning people come in, for example, or a coworker could come in and leave something on your chair and touch something. You can't just assume that it's my own personal space and that sanitation that I did when I left at the end of the day is still in place. Next slide, please. Collaboration spaces. We're human beings. We need to connect with each other. We need that social interaction. And most of us have places, whether they're in the open environment or in enclosed spaces, that allow collaboration to occur. Well, when you think about this, simple things, taking a tape measure and allocating 6 feet from chair to chair, moving the chairs, moving the furniture apart, or again, eliminating furniture. This is probably the best way to maintain social distancing in collaborative spaces. Next slide, please. Now I'm going to talk about midterm solutions. Everything I've gone through previously have been short-term, easy things to do, things readily available to you. Now we're looking at how do you modify workstations to create that separation and maintain social distancing in a more permanent way. These are things that are going to have extended lead times. This might take a little bit more dollars. So we want to have thought to this. Thoughtful design is going to make sure that this meets the end result. And that's not going to be an immediate reaction. We have to think about this. A lot of furniture, regardless of the manufacturer, offers add-on stackable abilities. So ways of increasing panel height to create that separation. And we have all, maybe not all, but a big trend has been to stand at work, right? We want to get people up that gets the blood flowing and the oxygen's moving and you're getting so healthy. Well, standing at your work surface now, think about that separation and that social distancing to the workstations adjacent to you. So really, again, thoughtful planning for what you're currently providing in the workplace and how we need to modify your furniture to create that separation. Next slide, please. Another example of that same ability to raise heights of your current furniture to offer an increased separation. By raising height, it doesn't have to mean a visual barrier. It is important that people see movement, that people understand there's things going on around them, that they have access to natural light and to the environment as a whole. So glass barriers are going to be preferred versus solid barriers. Also, when you think of a sanitation situation, they're easier to disinfect than fabric. Next slide, please. This could apply to the short term or the midterm, but you might have things within your organization that can help you create division or separation. Mobile marker boards, mobile screens. I also think about this as an investment standpoint. You as an organization could buy this screen, for example, this marker board, this mobile device, yes, and it would be doing two things, so it's multifunctional. It creates separation, but it also can be a tool for using to support your workflow and your work processes. Next slide, please. Now I'm going to kind of dive into the more long-term solutions and considerations, and this is a really interesting topic when you think about what we don't know yet, what is going to evolve into our workplace. But there are things that we do know. We should and always should be considering our air circulation, our airflow, air handling equipments. How is air moving within the space? Have our filters been changed? Some very basic maintenance things, as well as deep diving into those systems. There's some dollars invested here, so this is going to be a bigger ticket item. But other things that aren't a big ticket item are really things that we always should be doing. Adding plants to an environment. They clean the air. They help clean what is in the air. Access to natural light helps the psychology of people feeling better at work. So some very simple things that we always were doing and some things that we need to be doing moving forward. In addition to that, and I would ask for the next slide, please, I want to consider or help us think long-term more in modularity. Think about flexibility. We are in a situation right now where we have an environment and it's fixed the way it is, and we're looking to quickly modify it. But if the sky is the limit and we can create a different environment, potentially using modular elements that could easily accommodate ebb and flow, move and change to accommodate anything that would be coming down the road. And modular construction, that's a big topic, and it can be lots of things. It can be something like this on this image, or it could be some other images that we're going to see in a minute. Next slide, please. Part of modular construction, in my mind, is where do you want to take that testing? Both Lori and Gary talked about testing, and down the road, who knows what that will mean. But creating testing stations out of modular construction or modular furniture, that can help us put things in place today that maybe we need in the future, or put things in the future that we would need long term. Next slide, please. Again, modular construction, building rooms, pods, walls, this can be easily changed. So when you think about your conference room that today sits 14 people, but really in the short and midterm is only going to accommodate 7, wouldn't it be great if we could just move those walls and create smaller meeting spaces, or take the walls out and create larger meeting spaces? With traditional construction, that's very challenging to do and costly, but in modular construction, it's not that case. Next slide, please. Hands-free, obviously that is something we need to consider definitely moving forward in the long term. We're familiar with things like faucets, soap dispenser, toilets, but now think of it in a different way. If every door didn't have a hardware, didn't have a handle, but it had a motion sensor, not just your entry door, but the door to your office or the door to the bathroom, or potentially the bathrooms are configured so they don't need a door. Wouldn't that be amazing? Also, trash. Everyone has a trash dispenser in your break room, in other areas. Well, if that was hands-free or motion sensor controlled, those would be things we need to consider. Another area is millwork. Copy machines, copy areas, break rooms, things that have storage. They all have a handle. People are touching them. Well, potentially we need to consider taking off the handles, taking off the doors. So now when you need that ream of paper, you can just bend down, grab the ream of paper and move on. You don't need to consider touching and then sanitizing. So hands-free opportunity is going to be huge in the future. Next slide, please. A couple other long-term considerations that I would share with you would be simplifying transition spaces, lobbies, reception areas. They don't need to be as large. They don't need to accommodate as many people. Eliminating seating, taking out tactical materials. Typically, reception areas are our image areas. We want to reflect a certain image, and we can still do that, but maybe we need to simplify those things. Elevator lobbies, building cores, things that we really want to take a look at and make sure that they're simplified. Fabrics and textiles. You know, we want to have that homey feel or that soft feeling. Fabrics absorb sound. They do a lot of things for us. How do you clean them? Some people have the perception that you can't clean them. And that's not true. The right fabric can be cleaned with the right material. So changing how you think about fabrics or the specification of materials and making sure it is bleach cleanable will be important. There are a lot of new technologies out there with fibers, antibacterial technology, and it goes on from there. So really thinking about the needs. They are a little bit more expensive, but we want to make sure we're selecting the right material for the right application. Technology will continue to be critical, not only in upgrading to continue remote access and remote ability, but also thinking about tracking. If all of your workstations or workplaces were unassigned and people could come in and work wherever they wanted, that would be helpful from a sanitation, a flexibility for a lot of reasons. But now how do you track where people are? How do you reserve a location? Well, there's a lot of technology that will allow you to do that. It will also provide data and analytics so that if you do have an outbreak, you can track the exposure and where people are or have been. And the other area that I want to consider from a long-term perspective is altering how we think about enclosed meeting spaces and private offices. Potentially those will increase. And another one that I really think is important for all of us to understand is what work looks like in the future could be different. You could be working primarily at home and come into the office for 1 or 2 days a week, or you could be working in 3 locations. You could be working in an open area, an enclosed area, and your home. So work is going to change, and we want to make sure that we're creating environments that are flexible and give people the choice to work where they want to work. The last slide is really talking about communication, and I think both Lori and Gary talked a lot about this. Communicating to your teams and keeping them abreast of your thoughts, abreast of what they're going to see in the office is important. There is also a plethora of survey tools that you can put out to ask your teams how they're feeling about things, what they want to see happen. This would help you get information so that you can make informed decisions on both the short, mid, and long-term solutions that you could implement into your spaces.
Verna, thank you very much. Just great content from all 3 of the presenters. So we have a number of questions. We've got about 13, 14 minutes, so we're gonna get into that quickly. So the first question, Lori, what about the employee who's been teleworking during the pandemic and wants to continue working at home? Can you require them to come back? You might have touched on it earlier, but maybe you could go over that again.
Yeah, I mean, that is a little bit of a twist on the question of whether the person wants to come back. But, you know, this is, and I'm kind of contemplating the person who has never been working from home, but got used to it, maybe likes it quite a bit, and they would like to work from home, but that hasn't been your culture, and maybe that isn't what you would like. I think first off, you have to clear those first hurdles that we talked about. You have to ask why. Dialogue with your employee, figure out what is it about working from home, or what is it about not returning to workplace that's the issue. Find out, is it childcare issues? Is it fear of the workplace? Is it medical vulnerability, you know, stuff like that. All the things we talked about earlier. Generally, there is no legal requirement that you continue to allow telework. However, and this is a big however, a couple howevers I would say. One, you may be legally required if the telework is an accommodation for a disability, and you don't know that unless you start asking questions. But if there is no legal requirement, the other, however, has to do with why, as an employer, you don't want that to happen. That requires you to kind of dig in and say, has the employee maintained productivity? Maybe they think they're wonderfully productive and efficient. You have a different opinion. Can you document that? Look, you didn't get the work done that we wanted to. We want you to collaborate. It becomes a little dicey when it's more difficult to collaborate in person and people are collaborating remotely anyway. But, you know, the bigger, I guess, other category of however is, just as Verna just said very well, the workplace is changing. People, you know, I don't know how many articles there are about millennials and and younger folks even who are expecting flexibility and things like that. And so from both a morale perspective and from a recruiting perspective, you should be cognizant of that. That isn't to say that every workplace is a teleworkplace and that's just the way it is, but you should understand that the world is changing a little bit. And to the extent that a person is productive and efficient and you want to keep that employee, maybe you think about it. Or maybe you do it, you can work from home 3 days a week, like Verna suggested. Maybe not all the time, but that's what I would say to that.
Okay. Gary, it's my understanding that if an individual in Waukesha County tests positive to COVID-19, the Waukesha County, west of Milwaukee, I know you're from anyway, the healthcare provider is required to contact the county's public health department, who will then call the individual's employer as part of the county's contact tracing process. Do employers need to implement their own separate process to comply with OSHA?
Yeah, I would recommend as part of any exposure control plan that part of the plan requires employees to notify their employer if they've tested positive for COVID-19.
Very well. Verna, there's some questions about bathroom modifications. You talked about that. Hands-free plumbing. What do you need? Could you talk a little bit more about the reception area and what you might need for that? With visitors coming in and deliveries, and maybe even temperature testing if a company wants to do that. What are some things that you'd recommend or can talk about there?
On the short-term side of that, we would recommend potentially a plexiglass screen and developing some protocols. So visitors and guests are allowed into a designated area. If you choose and your protocol is requiring temperature checks, that's definitely something you can do. Infrared scanning is another technology that can be implemented in the long term in reception areas. So really it's about limiting exposure and access. Mail and deliveries, we definitely want to think through that and make sure that we have a designated spot for that, so that instead of those packages traveling, you go and get your package after it's been sanitized. If that's your choice, you can go and sanitize it when you pick it up, but leaving things in designated areas and not having people have as much access as they used to have.
Great. Gary, what's the biggest misconceptions you're seeing about making office conditions safer? What are people maybe going overboard?
Well, I think I gave a good example with the temperature taking. It's not a requirement. In some cases, it may be prudent and wise, but if your workplace is not densely populated and there are very few cases in the county in which you work and your people live, then I would say that's probably overkill. To some extent, the same thing might be said about people wearing masks inside of the building. Now, you're going to have to look at your state and local requirements when it comes to wearing masks, but if you're in a building far away from other people, it just doesn't seem very productive to require people to wear masks even when there's no one close by.
Maybe you could say wear masks if you're walking around, but in your desk or at your workstation, you don't need to do it.
Exactly.
Compromise.
Exactly.
Lori, a couple of issues related to collecting unemployment. So if an employee refuses to return to work, will that affect their ability to collect unemployment? And then got a follow-up question regarding furlough.
Unemployment is, just like workers' compensation, unemployment compensation is a matter of state law, so every state is different. But what I will tell you with regard to unemployment, generally speaking, in Wisconsin and a lot of other places, if a person has refused available work, they are generally not eligible for unemployment as long as that has been regular or well documented to the agency. Now, I would add a caveat to that. What happens if an employer has not done what the person believes to be, or what I should say OSHA or CDC has suggested is safe, and they are resigning because they believe that the employer hasn't taken adequate safety precautions? That is going to be, who knows what's going to happen in that scenario, but you should be aware that that's a possibility that they may, in fact, be able to collect unemployment if the unemployment division considers that to be a reasonable, their position to be reasonable. That's a very much a case-by-case thing, though.
Okay. And a somewhat related, but not really, question regarding furloughs. You talked about it earlier. You said companies could furlough individuals for days or weeks. Is that, does that provide a lot of flexibility where you're furloughed, every Thursday and Friday for the next 2 months, or for until further notice? Or does it have to be more specific than that? What kind of flexibility does a furlough?
No, a furlough, again, does not have a legal definition. It just generally means an involuntary, you're still our employee, maybe you're still on our benefits, but this is unpaid. And for reasons related to COVID-19, where we're going to either cut your schedule down, you're now part-time employees effectively, or you are, you're not working for the next 6 weeks for whatever reason, or something like that. The person is not furloughed, of course, if they are continuing to work and they're just doing it from home. But, a lot of what I have often seen is I am a manufacturer, I operate a plant. The production has gone down significantly. I have a plant manager who makes 6 figures, and I need that person to work, but their job that is 60 hours a week just became 10 hours a week because I need somebody there to check on things, whatever, but our production is down. What are we going to do? That requires, of course, a modification potentially of the person's pay structure. Maybe they just became a non-exempt employee because you're going to pay them partially, and maybe in reasonable circumstances they collect unemployment for the the balance. But that's often comes up.
Mm-hmm. Okay, Gary, you touched on it a little earlier. Maybe you could expand on a little bit. Employees, vacation, personal travel, business travel. What if the employee doesn't tell the employer where they were, and maybe they were in a hot zone, or they went to a wedding, or and weren't forthcoming with that information, or are they required to, what should employers know, and what can they do about that regarding their employees?
Well, not a lot they can do about things they don't know about, but when it comes to those things, I would also recommend taking a very practical approach. During the midst, the middle of the outbreak, where New York was in a disaster area, literally, there were employers that would decide we're not going to have employees travel on business to these hot zones. In fact, some employers even said that if you flew commercially, that's fine, whether it was personal or perhaps even on business, but when you got back, you were going to be subject to a mandatory 14-day quarantine.
Yeah.
So I would say, and in fact, something maybe, believe it or not, there are a lot of air changes on an aircraft. The design of the aircraft is to change the air frequently. A lot of people don't realize that, but it's the truth. Other forms of public transportation, like CTA buses, trains, that's a different matter. And some employers even said if you took public transportation, you would need to quarantine for 14 days. So again, be flexible. As cases are starting to decline, reevaluate what your position is and determine what's best for your business.
Mm-hmm. Verna and Gary, maybe this has to do with you. Somebody asked, how long can you be in close proximity with others? And any tips for people with anxiety return to the office? And that has to do with setting up your office space and traffic flow. I mean, if you're just walking by somebody, is that something to be concerned about? With the 6+ feet distance, or if you're officing 6 feet away from somebody, are there any studies, or is there anything that you can reflect on regarding that?
One thing I've heard is the 6-foot rule becomes critical if the time that people are together exceeds 15 minutes. These are all estimates. In fact, the 6-foot rule, believe it or not, was a result of the WHO in the 1930s based upon other viruses. So it's an arbitrary number to begin with. So you know, the further distance you are from somebody else, the better off you're going to be. But, you know, my wife and I will go out for a walk, and it's amazing how many people will go off of the walking path to make sure that they're 10 or 12 feet away from you. And I think this is due to fear and really lack of understanding. With viruses, and they're beginning to learn more about it. Again, this is a brand new virus. There is something to be said about what's called the viral load, so that the amount of infection that might be present in the air, it does matter. So if you're in a crowded room where that viral load might be very intense, your chances of acquiring the virus are pretty high. But if it's a large space with one infected person, it's going to make a difference, and there's a less of a likelihood of you being infected.
That gets into the air that Verna was talking about too. Keep a door open. I'm sure that would be advised in conference rooms. Keep the doors open and your office doors open as much as possible. There's a question, this is pretty quick, I think easy answer. We're thinking about sending out a survey to employees to gauge their comfort level for returning to work. Do you see any issues with that?
I would, depending on what you're going to ask them. If you are going to ask them, generally speaking, you know, what their comfort level is, what you don't want to do, of course, is do anything that suggests that you are asking them to disclose medical conditions. Mm-hmm. Again, my advice earlier was, you know, maybe you have that questionnaire that's a screening questionnaire about symptoms, and you add at the bottom, if there's any, but if for any reason you have a vulnerability, whether it be age-based or whatever, that you would like, and you would like to, in other words, volunteer to talk to us about, we have an open door policy. We're glad to talk about that. But we are not going to mandate that people, you know, answer those questions.
Okay. Any last thoughts from anybody? Because we're, I think, over time. All right. Well, this concludes our webcast. Thank you so much to all of our presenters and partners, Lori Meyer with Davis and Kilthau, the employment and litigation team, the litigation team, Gary Glader of the Horton Safety Consulting team, and Verna Shavlik with Creative Business Interiors and the Interior Design team. So these are the experts, everybody. You'll find their contact information and their email addresses below. If you have any questions, please contact them. I know they're available to help you as you are navigating through your journey and getting back to business. As I mentioned, the slide deck is available online. The instructions are, when you exit the webinar, a new tab will open in your browser with the survey, the slides that are accessible. So on behalf of BT360 and BizTimes Media, thanks again for everyone for taking your time out in the day, and enjoy the rest of the day. It looks like it's 66 degrees on the four-sided clock downtown Rockwell. So enjoy the rest of the day, everybody, and thank you.
Take care.
Bye-bye.